Victoria has recorded 384 new cases of coronavirus and 6 more people have died. Premier Daniel Andrews has also announced all elective surgeries, except for Category 1 and urgent Category 2 operations, will be suspended in the lockdown zones to preserve resources. Here's reporter Stephanie Ferrier.
Well, as you just mentioned, 384 new cases here in Victoria. Now, that, of course, is a step down from the 532 that we saw yesterday, which was our record number and the highest tally yet. So hopefully that is a good sign at least. However, of course, as you mentioned, 6 deaths, which is really grim news indeed. We have heard that they are including people in their 2 people in their 90s, 3 in their 80s, 1 in their 70s. 4 of the 6 deaths relate to people from the aged care sector, from private aged care homes. Now, we also heard that there are now 4,775 active cases across Victoria. There are 414 health workers who are infected with coronavirus at the moment, some 769 cases in aged care. Now, that's a jump of nearly 90 from yesterday, so that's quite significant. We also have 260 people now in hospital, and we understand that there are 46 of those who are in intensive care.
So tell us about the measures then that have been announced today to try and handle outbreaks at aged care facilities.
Yeah, so the Premier Daniel Andrews was talking about the situation in aged care, saying that some occasions it's just simply not been acceptable. And he has said that if and when required, they will be moving people out of those aged care homes and into hospitals, both public-private hospitals. He has said that some 200 residents have already been moved away from some of these facilities. However, it's not a suggestion that anybody who is in one of these affected aged care facilities will be moved en masse. It will be done in a clinical way and under clinical guidelines and what is best for that resident at the time. Now, he also said that he's obviously trying to ensure that they can get as much help as possible into those aged care facilities, and that is why they are going to now move to cancel all but Category 1 and the most serious Category 2 surgeries across Victoria to help free up those vital nursing staff and healthcare workers to be able to go in to some of these aged care settings. Now, we heard, for example, for one, the Eastern Health Ioneer Hospital are now closing beds as we speak, and they are going to be moving those nurses into a number of those aged care residences to provide the best care possible. Let's have a listen to what Daniel Andrews had to say.
I cannot stand here and tell you that I have confidence that staff and management across a number of private sector aged care facilities are able to provide the care that is appropriate to keep their residents safe. If I could say that, I would. But I won't stand here and say that, and I won't stand here also and say, oh, well, this is just a Commonwealth Government matter. We don't run this sector, but the residents in these homes are all Victorians. The Commonwealth Government have asked for help, and that is exactly what my government and our agencies will provide to them.
So that's the Premier, Daniel Andrews there, and he has called this situation a critical challenge for both the state and federal governments. They are Victorians first and foremost, and he says that we will do everything possible here to help those aged care residents get to a safer situation as quickly as possible.
Stephanie, thank you.